Thanks everyone for joining us for today's webinar. Today we're talking about exercise physiologists because they really can be your new best friend. Exercise physiologists are fabulous at tailoring an exercise plan for each of us and particularly looking at wellness. So it is my pleasure to have Tasha waiting in the wings. We start all our programs in the spirit of reconciliation with an acknowledgement. So in the spirit of reconciliation, MS Limited acknowledges the traditional custodians of country throughout Australia, and we acknowledge their connections to land, sea and community. We pay our respects to elders past, present and emerging, and we extend that respect to all Aboriginal and Torres Strait Islanders with us today. As I said, it is my pleasure today to have Tasha Babet with us online. Tasha is one of our exercise physiologists who works in the Lidcombe gym, normally in the Lidcombe gym, but at the moment everyone's working from home, of course. Tasha has been an exercise physiologist here at MS for the past 2 years coming up. She started part-time purely for home visits, but she's been full-time since March last year, continuing with her home visits as well as working in the clinical setting in the gym. Tasha studied a Bachelor of Sports Science and then she also completed her Masters of Clinical Exercise Physiology. So she's well placed to share with us today.
All right. Hello, everyone. How are we going today? Hope everyone's enjoying the lockdown. That's really very exciting stuff at the moment, but we've got an hour of should be about an hour full of great information that I'm very, very excited to share with you all. So thanks, Andrea, for the introduction. But yeah, so here we are. My name's Tasha, guys, as Andrea said, and this is actually my first webinar that I'm doing, so work with me today. If there are any questions, I will try and remember to stop, but if so, like Andrea said, just pop them through and we can go through them as we go. So I'll pretty much just start with the outline. So obviously today we're talking about the role of an exercise physiologist. So hopefully a couple of you guys are already seeing one, but if not, if it's something that interests you, then hopefully this gives you enough information in order to seek out our services. Okay, so yeah, so the role of an exercise physiologist, the role of exercise in MS in improving general health and well-being, as well as the evidence-based approaches to exercise prescription. And then I'll quickly go through a case study with you guys and provide a general summary. All right, so let's get into it. Beautiful. All right, so what is an exercise physiologist? So an exercise physiologist is an allied health professional, and what we try and do, just like you would go to the GP to get a prescription for, if you have a chest infection and you need a case of antibiotics, what we try and do is we try and use exercise as medicine. Okay, so we look to evaluate and design an individualized program for our clients, and that could be for a range of different medical conditions and injuries as well. So in order to gain accreditation, it's usually I had to study 4.5 years. So I did a bachelor for 3 years and my master's in clinical exercise physiology for 1.5 years. There are bachelor degrees as well, which go for about 4 years. And then you have to complete 500 hours of clinical placement. So you must cover the 4 different main categories, being neurological, musculoskeletal, respiratory, and cardiometabolic, as well as some fun admin hours in there as well. And we're accredited through Exercise and Sports Science Australia. So they're the head of what we do, and we got all of our regulations from there. Okay, so we're just going to touch base on the exercise professionals that you might see when trying to complete an exercise program. And it's good to have a bit of an understanding of the 3 different ones that we've got here. So personal trainers, exercise physiologists, and physiotherapists, as some people can get quite confused as to what each of those do. Okay, so in regards to personal trainers, they are trained to work with general healthy populations. So they aren't able to provide a diagnosis, but they do use evidence-based research in order to create programs for their individuals. Now, for exercise physiologists, we work with people with chronic conditions. So we're trained to do so for neurological, musculoskeletal, cardiovascular, and metabolic conditions. We're also unable to provide a diagnosis, but we also use evidence-based interventions in regards, for chronic condition management, as well as recovering from injury. So whether that be, a shoulder injury that you're having as well, so we are able to prescribe exercise programs for that. Now, with the physiotherapists, so they work with acute and subacute injuries, so that could be neurological and musculoskeletal, and they are able to diagnose. So they can order for medical imaging as well, so whether that be, CT scans or MRIs, and then through that they are able to diagnose, as well as being able to refer you on to see certain other health professionals. They do use things such as massage, dry needling, manipulation as well. So I think that's a main difference between exercise physiologists and physiotherapists. And they can also prescribe things such as assistive technology. So if they see that a foot drop is present, or and they want to help with walking, then they can also offer you assistive technology such as things like dictus fans and AFOs as well. So in saying that, there are 3 different exercise professionals here, although they do work really well together as well. So having a physiotherapist, being able to provide you with an assessment and making sure that you've got all the tools that you need. They can then refer you on to see an exercise physiologist. The exercise physiologist is then able to implement an exercise program with you, looking at all things. So not only just in this case a neurological condition, but also looking at those musculoskeletal problems as well, or any other issues and concerns you might have, and then create an appropriate exercise program which is individualized for you. And in some cases, what we can do also is refer you on to a personal trainer, and then being able to have them implement that exercise program with you as well. So it is really good to have different health professionals working together. I think just one thing to note with this is just making sure that there's good communication amongst all of the health professionals who are involved in your exercise program. So just making sure that if there's anything that comes up, or any concerns that a health professional might have, it's really important to touch base and make sure that everyone is on the same page to then ensure that the client is getting the most optimal health advice. All right, so in regards to referrals, so there are a couple of different ways that you can gain a referral to see an exercise physiologist. So the first one that I've listed there is just the GP. So if it is something that you're interested in, you can always go and express your interest to the GP. And then they can also prescribe, also refer you on to an exercise physiologist through the chronic disease management patient plan. So that's where you get 5 sessions that the GP might recommend that you have 1 for a physiotherapist and 4 for an exercise physiologist, and they'll write out that plan for you. So you can get a referral through that. You've also got your physiotherapist and your neurologist as well. So if you're not already seeing seeing an exercise physiologist, you can always go and speak to your physiotherapist or your neurologist, and they would be able to refer you on to an exercise physiologist, which is available in an area that is close to you, making it more accessible. And the other option as well is that you can have a look at the ESSA website. So I've just popped the link in there, and there's also a little photo that you can see, which shows you how you can do the search engine. So if you just pop in your postcode, and you can simply just do your postcode and the distance. So whether you want it to be, within 5 kilometers, 10 kilometers of the postcode that you're living, and then that way it'll show you all the exercise physiologists in that area as well. Another one though is if you do have a support coordinator, you can always express your interest to them as well, and they would definitely be able to assist you with finding exercise physiology services. Okay, so talking about the MS clinic in Lidcombe. So obviously that's where I'm located, and it's held very close to my heart. So we've got physiotherapists there. So the physiotherapist provides a one-on-one assessment to focus on symptom management and assistive technology. So like I mentioned earlier, if they can see from your assessment that you're struggling with things such as foot drop, then they might recommend that you have some type of assistive technology in order to help with your walking. They also provide exercise recommendations to our EP team. So after that assessment, we get a run through of the findings and the different observations that are made. And then from there, they provide some recommendations that they think would be suitable for our clients. And then going on to the exercise physiologist. So what we try and do is we try and facilitate an individualized exercise program. This does usually occur in a group setting. Okay, so usually we have one exercise physiologist to 3 clients, and we try and implement our program in that way. There is also the opportunity when there is capacity to have one-on-ones in the gym, but mainly we do work on a group. We work in a group setting in the clinic, and we have also the one-on-one sessions for home visits. Okay. So we do design the exercise program, so whether that be in the gym and for some clients as well who would like, we do offer home programs, and then we review these programs. We try to do that at least once a quarter, okay? I think this is my favourite point of this slide. The clinic in Lidcombe is a beautiful place to be. We really try to provide a vibrant and uplifting environment for our clients, and I know that I get a lot of comments from the clients that I see saying that it's a really good environment to be in because you're surrounded by other people who understand, you know, what you're going through. And, you know, we also just try and make sure that we're uplifting and really positive for our clients. So, you know, it's a place that they want to be at, because it's when people think about exercising, they might think, oh, I don't want to do it. But we really try and, you know, bring a bit of life to it and make it a bit more exciting as well. So that's just about the Lidcombe Clinic. About the other services in New South Wales, there also is, so obviously with the physiotherapy and the exercise physiology, from the lockdown that occurred last year, we did start off our telehealth services as well. So those are both available for exercise physiology and physiotherapy. There are dance classes and yoga classes available at the Lidcombe site, and the Marrickville location as well has the yoga classes, and there's a different range of exercise classes available in East Gosford and Chatswood as well. Given the current lockdown, this can obviously hinder the services that we are able to deliver. But yeah, there are quite a large range of things that are offered here in New South Wales. If you're tuning in from any of the other states, we've got Victoria, which has exercise physiology services through telehealth. And they've also got physiotherapy services of home visits and telehealth. So, sorry, just touching on the location dependent, it also does depend on where you are situated, because it's usually within about half an hour of we have to travel, so within half an hour. So if that isn't in our range, then obviously we try and offer telehealth for our clients, or try and find another service that might be closer to you that you can use as well. And then for Tasmania, obviously, we've got exercise physiology and physiotherapy over telehealth, as well as ACT there with the same, as well as the extra exercise groups in Deakin. Now, talking about the, did I just skip one?
Sorry to interrupt. I just thought that might be a good place to remind people, or to let people know that there are more programs coming available online because of the COVID lockdown. So yeah. I know we've just organised one of the Dance for Health sessions online. So watch out for that coming to your inbox, an advertisement for that. And it's finished right at the moment, but generally we have Tai Chi or Pilates operating online as well. So when people can't, or maybe aren't in the area where there is a gym program like you beautifully described for Lidcombe, there are other ways that we can get that program to people.
Yeah, definitely. That's a good point. Thanks, Andrea. All right. Okay, so touching into exercise physiology and the NDIS. So being covered under the NDIS, obviously we have two funding categories that we use for exercise physiology. So our most preferred is usually improved health and wellbeing. This funding is usually used for exercise physiology and dietitian services only. But we can also use improved daily living if you aren't given health and wellbeing funding. Just taking note that with daily living, it is shared, with other services as well. So you've got obviously your physiotherapist, your occupational therapist, speech pathologist, psychology, and there could be a couple other as well. So just in that, you just have to be mindful when using that category that we're able to utilize that through all services that you're using, just so we don't use all of it for exercise physiology, but they're the two categories that can be used for exercise physiology as well. Okay, so getting into the fun part about the role of exercise in multiple sclerosis and general health and well-being. Okay, so if we're just going to talk exercise and physical activity as a whole, just for the general health and population, physical activity is extremely important. Okay, so the World Health Organization, now I've just got two little quotes there from them. So physical activity is defined as any bodily movement produced by skeletal muscle that requires energy expenditure. So that can be, doing your grocery shopping, cooking, cleaning, doing your gardening, anything like that is included in physical activity. Okay, and this is really important across all ages and should be integrated into multiple daily settings. So as we can see in the little table here, physical inactivity is the fourth highest cause of death, okay? But physical activity can then have a huge impact on at least 5 of the 6 top causes of death. And it's funny that it's something that, I would say quick fix, but it's not a quick fix. But physical activity in some countries can be shown to have inactivity levels up to 80%, which is a crazy number. Okay, so the benefits of just moving, and I say any movement is good movement. So whether that be just, in the middle of your favorite show, or I've been watching The Voice lately with my parents, so getting up and getting any type of movement is so beneficial for us. Okay, so I'll go through to the next one, and that'll touch base on some of that benefits. So if we're talking about benefits, obviously we're looking at improved quality of life, reducing the risk of any other health diseases. So whether that be heart disease, stroke, diabetes, they're 3 that are listed there, but also things like high cholesterol, anything like that. So improved psychological outlook as well, which is a huge one. There is a lot of research on the great impact that exercise and physical activity has on psychological health. Obviously looking at stronger bones and muscles, so that's highly linked to our resistance training, and some good ones there as well. So improved sleep and improved cognition, alertness, and energy levels as well. So I really like this quote. So this is one from Dr. Terry Wars. You can only do what is possible for you, and what you must not do is neglect what is still possible for you. So just saying that try as much as we can in our own limits is really important. Obviously, with people with multiple sclerosis, we're going to see a different range of physical capabilities, but just trying to stay within your limits, staying safe, but also trying to get as much movement going as possible. Okay. All right. So now exercise and MS specifically. So there is a lot of research that is going on over the years and still up and coming. That's a great thing about science. There's always studies that are happening, but there is ample amount of research to show that exercise greatly benefits people with MS and the symptoms. So one thing that we have to know here is that exercise helps with managing MS symptoms. So we're looking at managing it, okay? Where we can, we love to improve, but things like, for example, muscle weakness, and maybe things like balance as well, you'll see that things like resistance training will be very beneficial for these things. So just giving you an example, obviously having strong leg muscles or trying to regain that strength will play a massive role in the way that you're able to walk and uphold yourself. And that also links in with things like balance, okay? So for balance, one thing that usually happens when people have weaker balance is that they have weak hip stabilizers, okay? Because obviously standing on our legs, we need to have really strong hips in order to be able to do that and balance, okay? So it shows that obviously with resistance training, we'll be able to improve that or manage those symptoms. I think another one that I've always found interesting, and a lot of clients find interesting as well, is fatigue. So obviously fatigue is a very common symptom for people with MS. And one of the things that people have have a misconception that I'm too tired, exercise is going to make it worse, when the studies actually show that exercise is extremely important in trying to manage fatigue. Okay, so I guess the one thing that we have to know with this is that it's really important to try and figure out your limits, and that's why it's really beneficial to see someone like an exercise physiologist, because we are then able to know when it is safe and how far you'll be able to push yourself in order to do that in a way that is not going to run you out for the next week. Okay, so we're trying to find that balance of doing enough but not doing too little. Okay, so obviously these symptoms that you're having might be dependent on where the lesion is, but there is definitely some great benefits of doing exercise for people with MS. Andrew, is there a question?
Yeah, there is. There's a question that ties in really well there. That's why I thought I'll just hop in now.
Yeah.
Samantha's question is, should she tell her exercise physiologist if he's working her too hard? Because she knows the point is to get her stronger, but sometimes she has to push through and gets fatigued for days after that. So it's that exactly what you were talking about. How do you work out that balance?
Yeah, definitely. Look, if you feel like you're getting pushed extremely hard, I would definitely say that it's good to communicate that with the health professional that you're working with. It's always good for us to know. And I think that one thing that I tend to do is that once you're working with a client for quite a fair amount of time as well, you get to understand when you're prescribing maybe a bit too much, when they're having a good day, when they're having a bad day, because obviously with MS, that's what happens. Sometimes we have great days and we can do 3 lots of 10 and ease through it, and other days, we'll get through that second set and we're like, oh my gosh, I can't do another one. So it's definitely good for us to know, and we're able to factor in different things. So we might ask questions like, have you done a bit extra this week? Or, maybe the weather might be something that's affecting it as well. So it's definitely good for the health professional to know when you do feel like you're getting extra tired or you're feeling extra fatigued from your session. And that way we'll be able to make a decision on how much we can prescribe, and yeah, just make sure that we're doing that in the safest way possible. So any concerns that you have, there is never a silly question. There is never a moment where we're like, oh my gosh, they're complaining too much. There will never be a moment like that. It's always good to communicate that with your health professional. Yeah.
That's great. Actually, that just reminds me too, it could be worth people knowing that we run health professional programs as well. So if any of the clients online are working with health professionals outside of MS, feel free to tell them that they can sign up for a monthly newsletter about upcoming PD programs. And I know coming up in the next couple of months is one that is specifically about exercise. So it could be really timely if they get themselves onto our newsletter, which is called Inform for health professionals. They'd be notified about those programs. And then that will help you because they'll have a better understanding of MS.
Yeah, definitely. Yeah, great point. Thanks,
Tasha.
Andrea. No, thank you. All right. So that sums up that. We'll move on to the next one. So this one is a bit of a science update for you all, so I hope you all follow, but I'll try and relay this in the most simple way possible. Okay, so when we're talking about exercise and MS, obviously there are ample amount of benefits from it. Okay, but I'll try and explain to you what's happening just so we can have a better understanding and then understand the importance of exercise. So obviously with multiple sclerosis, it is an autoimmune inflammatory disease and it's neurodegenerative. Okay, so what happens with MS is that we've got the demyelination of the axon. So what that means is when we've got the signals coming from the central nervous system going all the way to our receptors that are allowing us to do movements, or so I should say make movements. The inflammation that is happening or that is caused from multiple sclerosis is then causing a blockage in the pathway. Okay, so that's what sort of brings on the fatigue. That's what makes it difficult to do things such as walking, or maybe you have gripping issues and things like that. Okay, so I should say first, sorry, there's two different factors that we need to be mindful of. So we've got the nerve growth factor and the brain-derived neurotropic factor. Okay, so these two factors are what helps with regulating the growth, the maintenance, and the survival of cells. Okay, so exercise has proven to be able to increase these factors and then cause a decrease of relapses, as well as try and slow down the progression of the disease. So with MS, obviously we have brain atrophy. So you can see that in the images that we have here of a healthy control, and then we've got two images next to them as well with relapse remitting and progressive MS as well. So we can see that the white matter is decreasing. So that's what atrophy is. Okay, so we've got a decrease of the white matter, which is what can cause the changes to motor and cognition. Now, what we're trying to do through exercise is try and increase our brain reserve. So our brain reserve is the brain's resilience in order to deal with the increasing damage that is happening. So obviously with aging, this happens naturally, but with MS, this happens at a more progressive rate. So through exercise, it is proven that we can try and increase the nerve growth factor as well as the brain-derived neurotropic factor, which will then help with decreasing the progression of the disease. So I hope that helps you guys understand the importance of exercise. So pretty much any movement is good movement. And the one thing that I say with the signals, and what I've explained to some clients before at the clinic, is that what we really want to do is we want to make sure that we're moving as much as possible. We're getting up, we're doing as much as we can do in order to let those signals keep on flowing through, okay? Because if we stop doing that, obviously there's going to be a breakage in those signals, and then unfortunately, we can lose the ability to do things that we used to be able to do. So movement, movement, movement. I can't say it enough. Super, super important. So yeah, definitely research is showing that exercise is very, very beneficial for people with MS. Okay, so when we're talking about the different elements of the functional benefits, we need to make sure that when we're creating a program, we look at all the different factors, okay? So obviously we've got strength, mobility, balance, aerobic fitness, psychological well-being, which is also extremely important, bone density and secondary, or trying to decrease the chances of secondary diseases as well, okay? So when creating a program, we just need to make sure that we're looking at all these elements in order to make a holistic approach to that program, and making sure that it's individualized for the client. So for example, I have a client who is still working, he's an electrician, and we need to make sure that he's able to get onto the ladders and do the work that he needs to do in a safe way. So obviously through increasing his lower limb strength, we're trying to increase his balance, so he's able to stand up on the ladder safely, and things like that are very, very important. Okay, so there are always different things to consider when it comes to creating a program. Again, talking about that anti-inflammatory response. So we're just trying to get those signals getting sent through, keep on moving, trying to do as much as we can in order to make sure that we can slow down that progression. And then with regarding brain health, so the neuroplasticity element as well, and neuro regeneration, which is really important. And the thing that I like to do with this as well is sometimes I like to add in little cognitive things. So, for example, I might be doing a balance exercise with a client, and you can get them to name different countries in the world, or another thing might be using things like colors. So, for example, if you've got different colors, and say while they're balancing, get them to maybe point to the blue one, point to the green one, things like that, which also work on cognition, which is very, very important. Okay, so this slide is pretty much just to give you guys a bit of confidence in us that we use research in order to implement the most effective and optimal program for our individuals. Okay, so with MS, there are never two clients that are the same. So we do also have to have clinical reasoning with each of our programs, but it's really important to know that we use this research in order to make sure that we are ticking off all the boxes and providing you with the best program that we can offer. Okay, so the thing I find with research as well, it's really difficult to have one set recommendation that works for everyone. So there might be different findings that we can then use that work in relation to our clients. Okay, and what we try and do is just make sure that our client is happy, but we also need to make sure that as a clinician we are able to make sure that we're targeting all the things that are really important for our clients. So I know that there are a couple of slides of research as well that are towards the end of the presentation that you guys can have a look at from your handouts as well if you want to have a bit more of a read. But do be assured that there's a lot of research, a lot of thought, and a lot of time put into the programs that are given from exercise physiologists to our clients. Okay, so pretty much this is summary. So obviously from the research, like I've said, I could say it 1,000 times, exercise has great benefits with managing the symptoms for people with MS. There is a lack of high quality evidence, of course, like I said, given that no two clients are the same, which means that it's not always going to be clear cut. And it would be great if it was. It'd probably make my life very easy. Everyone would get the same program, but no, we need to really make sure that we're tailoring our program to each of our individuals and making sure that that each client is getting out of it as much as we can give them. Okay. Yep. So exercise may ultimately lead to improved function and mobility and quality of life, and exercise did not lead to an increase in relapses or adverse events. So that's a big one as well. Exercise within limits and with safety is very, very beneficial. And this is another really good point. So what the research doesn't tell us, yes, we need to enjoy it. We need to try our best to enjoy it. If we really don't like it, I know exercise can seem exhausting. I know with myself lately, I've been training before work and I'm up at 3:30 in the morning, and sometimes I don't enjoy it, but it is really, really beneficial, and that's the reason why I keep on upholding that. And I think the one thing that is very, very important is just to make sure that we make that meaningful to our clients and specific to their needs. So, for example, I had a client who used to play basketball before, and she's like, I haven't shot a basketball in 15 years and I would really love to. And I'm like, okay, beautiful. So knowing that that's a really it's a really important goal for her, and it would bring her so much excitement and happiness. then I'm able to tailor my exercise program to make sure that, you know, we can try and work towards that goal for her. And that makes the program more meaningful to her. So that is another thing that all your exercise physiologists should be doing as well. So touching base on that, so an effective exercise program, so it should be an evidence-based individualized program. So making sure that we are looking at the client as a whole, and we're able to provide them with exercises that are important for their condition, as well as any other underlying health issues that they might have as well. Another big one is identifying barriers. So this one's always really exciting. I've got a couple of clients who I know have lots of time on their hands, keep on telling me they don't have enough time, and it's all about trying to make the time available. So one thing I find as well, especially now that we're in lockdown and unfortunately the Lidcombe site is not open, one thing that I always do checking in with my clients is the time that I used to see them. I say, make sure that, at Monday at 8 o'clock in the morning, you used to be coming into the clinic. So let's make sure that that's a time that you put aside for exercise. And they don't have to worry about travel either at the moment. So, trying to identify the barriers and then being able to try and find out ways that we can overcome them. Another barrier might be, people with children, especially now. Homeschooling might be a thing that might be consuming a bit of time for some parents. So maybe even thinking about things like incorporating, the family. So even things like throw and catch that works on hand-eye coordination as well. So just trying to identify those barriers and be able to break them down as best as we can. So making it meaningful, like I said before, so trying to make this specific to the client and having it be something that they can enjoy, because enjoyment also will then promote adherence, okay? And as obviously it's great to see, someone in the clinic face-to-face once a week, but we also want to make sure that this is a program that they will be able to sustain over an amount of time, so like getting themselves into a good routine is really important. So that's one thing. Setting your goals, so having little goals that you might have, expressing them with your exercise physiologist is really important. Like I said, one of my clients with the basketball, but I had another client who just wanted to, I just want to vacuum my house. I'm like, okay, beautiful. So having those little goals, expressing them to your exercise physiologist, and then being able to implement things in the exercise program that will help them do those things. Okay. So support systems, that's another big one. It's really, really important, if there are support systems in place, that if we can and if we've got consent to be able to involve them. Okay, so making sure that there's contact, again, if there is consent to, so trying to involve those support systems in the exercise regime might be really beneficial as well. Education. So education is an interesting one. I think that one thing that's really important is trying to express to our clients why it is important to do the things that we're doing. So giving them a bit of an explanation might increase adherence, in the sense that having an understanding of why we're prescribing the exercises that we are, how these exercises can help them, and then having an understanding of the benefits of this will then help with increasing adherence as well. And that last one there is a holistic approach to health. So we're just making sure that we're looking at the person as a whole. So making sure that we're covering things like mental health as well as the physical health, not only just looking at the neurological condition, but as well as any other musculoskeletal conditions or any concerns that the client might be having. Okay, so before the case study, Andrew, are there any questions that you want me to go through first, or am I right to roll through?
Yeah, you're right to keep going, Tasha. Thank you.
Right, beautiful, not a problem. Okay, so I have a case study here. KH. Now, KH is a 40-year-old woman who lives with her partner. She has the support of not only her partner but her immediate family. Got a couple of friends there as well. And also I forgot to add quite a few pets, which are very, very cute and makes life very, very exciting for her. So KH was diagnosed with primary progressive multiple sclerosis in 2016 and has not worked since then. So before I started seeing her, and I actually saw her first when I was a student exercise physiologist at MS, but before then she was doing quite minimal exercise and she mobilizes with a manual wheelchair. Also has just recently had a motor placed on that to make it easier for her to get around the house and just try and increase her independence a bit more. But she does require a bit of assistance with tasks of daily living. So that might just be things like transferring and getting into bed and things like that. So the clinical presentation of the client was that she was very eager to begin the exercise program, which is always a good start. It's always difficult when you have someone who's like, no, I don't want to do it, because then you're like really trying to drill in and try and get them going. So it's always a positive. Really good support from home, although given the current circumstances and I think that more so the mental health aspect of it as well, just lacking a bit of social interaction. So the client's goal was just to gain a bit more independence, be able to do a bit more around the household, and she really wanted to get out into the community independently, just so she felt like she was able to do a bit more. Okay, so in the assessment, so this part is really, really important. It's really important to gauge a great understanding of the client in order to give them the best program that we possibly can. So for the medical clearance, obviously we're looking at the background of the condition and the symptoms as well, whether they use any assistive devices, and having an understanding of the medical and exercise background is really important as well. So, you know, just in the sense that this client didn't have too much of an exercise background, but it's good to know when people might have been, you know, a netballer, or, you know, they used to enjoy running or things like that, because if that tends to be something that they want to try and implement in their program or try and have a goal to work towards, and we're able to give them the appropriate exercises for that. Now the walking assessment, so gait analysis, we did this in the bars as a client does use a wheelchair and is still able to walk at a limited range. So we did this gait analysis in the bars, in the parallel bars at the clinic. Balance assessment was done with the Berg balance scale. So this just goes through a number of different questions just to try and assess the balance, and you get a score from that. Then the muscle strength test we did was a sit to stand. There are obviously other tests that you can do, but this one was the most appropriate for the client. So I think that's another thing as well, just trying to pick tests that are going to be appropriate for the client and things that you can retest again and have some validity and reliability to it. Oh, I've written grip strength. Sorry about that, guys. Sorry. Grip strength, I should say. So just for upper limb grip strength. And then a psychological assessment as well. So the multiple sclerosis impact scale. This one, I say, obviously it's more of a subjective test. So this is a test that is completed by the client themselves. And the only reason why I like to do these tests, and I think that they are really important still to have the subjective measure, is because then you're able to see how the client might be feeling and how that changes over time as well, because obviously sometimes we're having good periods, we're having bad periods. So this is a really good way to indicate the mental health of clients as well. Okay, so now we're looking at the issues that were identified through the assessment. So obviously we've got upper and lower limb weakness in both the left and the right side, but the left side was weaker in comparison to the right side. The client is right-handed as well. So poor trunk control. So obviously having the client in a wheelchair, she's got poor trunk control, which is then affecting her balance and the way that she is able to walk. Then lower limb spasticity, which is a big thing. for her, because that can be quite debilitating. In regards to the muscle weakness as well, we've got lack of dorsiflexion, so having that left foot drop, as well as a lack of hip flexion. So these things will obviously affect her walking as well as that poor balance. Gait impairments, again, like I said, so that would affect the walking. Quite excessive fatigue as well initially, as well as psychological well-being. I found that that was something that I really had to touch base on quite frequently. And then lack of confidence in gripping objects in the left hand. So when I first met her, she did not want to hold anything in her left hand because she was quite fearful that she would drop it. Okay, so when we evaluate, so obviously we've got a sedentary client here with good social support, has a lower level of independence, but is really eager to commence regular exercise sessions. The one thing with this client was lacking motivation. So the one thing I reckon that I had to do a bit more was that education side of things, trying to educate the client on the benefits of exercise and how it's going to help her. And I feel like this did work for this client. It's not always going to work with everyone, but it was definitely something that I had to integrate a lot more in my work with this client, as well as what I like to do is just send little messages every now and again, just being like a reminder for your exercises and things like that. And this also taps into that next point there. So in regards to the psychological side of things as well. So just making sure that the client is aware that they're not alone, and that there is someone there that cares and wants to help them get better and help them achieve the goals that they have as well. Okay, so in designing a program, so obviously we have all our findings, and from our findings, and we need to try and make a program that is not only evidence-based, but just making sure that it's something that the client will be happy with and it will be important to them. Okay, so when we're talking about obviously muscular weakness, we want to make sure that we're doing resistance training. Okay, so that's both upper limb and lower limb exercises. For both our upper limbs and lower limbs, we're doing both the use of unilateral, so that would be like one-sided as well as bilateral, so using both limbs at the same time exercises in order to try and build the strength of the more affected side, as well as working in unison for both the left and the right side. Okay, spasticity. So this, like I said, this is one thing that affects the client quite a fair bit. So there is a lot of research behind stretching with spasticity. Okay, stretching is one thing I feel that sometimes gets overlooked. It's like, but very, very important, especially in this situation. So we're just we would be doing stretching, I think, at least once a week, a good stretching session. Because I also, see this client at home as well as in the gym. So I'm just making sure that we're really trying to integrate that to help with relieving that muscle tightness and some of the client's pain as well. And with stretching, obviously what we're trying to do, that's going to increase our range of motion, and we're trying to increase our mobility as much as possible. Okay, so the next one is obviously poor balance and falls risk. So obviously we're going to be doing balance training for that. For this client, the one thing that we were working on, and yes, so I should say still been working on, is even just trunk control in the chair. So just making sure that we're trying to engage our core, and we actually do like little leaning exercises as well in her chair. And obviously balance exercises, there's no one rule or one way to do it. This will vary with different clients. That this was the best thing for this client, as she does spend a lot of time in her chair. So we're just trying to make sure that we're able to engage our core and try and really engage in that trunk control, because that was a major thing that I saw with the gait training, which is the next one. So any gait dysfunction, we're trying to make sure that we're able to do things such as standing, and even tying into the gait as well as the muscular weaknesses. So resistance training, these two, like I said, work really, really well together. So making sure that we're strengthening up those muscles. So strengthening up the muscles of the legs, strengthening up the muscles of the hip stabilizers in order to try and increase her capacity for walking. Okay, then we have our grip strength, obviously, because like I said, she was really struggling to hold things in that left hand. She was quite apprehensive. So just doing some different dexterity exercises. This was a good one that I had for my client, that I just told her when she's watching TV, just get out like a little stress ball and just do a couple of reps in each hand in order to do that, but not feel like it's like a chore. And it's just like little things like that that you can, that exercise physiologists can add to your program that you can do that don't feel like you're doing anything too strenuous, but makes it quite easy to adhere to as well. And then the psychological and social wellbeing. So the one thing that I do with this client is just making sure that I'm having regular check-ins, seeing how she's going, making sure that she knows that I'm there if she ever has any concerns or anything that she wants to speak about. And that has been really, really effective with this client. Okay, so delivering the exercise program. She would tell you that I am a crazy woman. I am not. I think that it's really, really important to be able to have really good rapport with your clients as well. So building a good relationship with your client is very, very important for the delivery of exercise programs. And like I said before when I was answering the question, it's really important to be able to get to know your client and understand what their limits are. And having those good days and those bad days, we just want to make sure that the client is feeling safe. And the one thing I find that is really good with these one-on-ones and face-to-face sessions is that we're able to then know what the limits are and then be able to build up clients' confidence, okay? So when delivering this exercise program, we're then able to see, the client is then able to see that they're able to do things that they might not have thought that they could do before. And then through that, then we can also implement things like home exercise programs that they can do independently on their own. And knowing that they can complete them can be quite beneficial for adherence as well. So again, make sure it's meaningful towards to the client and their goals. So this was the client that just wanted to vacuum her house. So making sure that then we're able to increase her upper body strength. So obviously we're doing things such as bicep curls, we're doing some overhead presses as well, things like that, just to increase her upper body strength, and then allow her to be able to do some vacuuming around the house. And she actually was able to do some a couple of months ago, which was really exciting, and she was so excited about it. Even bought herself a new vacuum as a present to herself, which was great. So it's really good to have implemented a program that seems to be effective for her, that allows her to be able to achieve her goals. And I think that that's one of the reasons why I love my job so much. So that's great as well. And identifying barriers. So one thing with this client, like I said before, was lacking of motivation. So what I've done with this client is just set up a little space for her at home in front of the telly, that all her equipment is there. So that way, when she's just watching the telly, also with my messages, hounding her, telling her to do her exercises, that's just also a little bit of a reminder for her. So that way she can do the exercises at a place that's comfortable for her as well. So it's really important to monitor the exercise program for safety, and also to review the program as things change. So obviously with MS, we have to be mindful that there might be a progression of the disease, so that might cause a change in the program. And in some instances, we will see improvements, which is amazing, and then being able to adjust the difficulty and the intensity of the program for the clients to make sure that they're getting the most out of it. And again, just making it enjoyable, making it something that they want to do. So one thing that I can always say is that if there's some exercises that I say you have to complete. I don't care if you hate them, but it's really beneficial for you, and we need to complete them. But I mean, if there's ever a time where you really don't like something, just talk to your exercise physiologist, talk to the health professional that you're seeing, and just let them know. And if there's other alternatives that we can give you for your program to make it more enjoyable for you and make it something that you will feel happy to do, then we'll definitely do that for you. I mean, we're not trying to be slave drivers as much as we sometimes seem that way. We do want you to have the best outcome out of our program. So yeah, I would just say that if there's ever anything that you're concerned about or anything that that you might not be enjoying as much in your program and that's affecting you wanting to complete it, then just let your health professional know, and we'll do what we can to provide you with something that you can enjoy. All right, so onto the summary already. My goodness. Okay, so exercise is medicine. Exercise is amazing. Movement is great. That is probably the key thing that I can say from this. Exercise physiologists can play a significant role in your symptom management. So it's really important to be as open and as obviously to how comfortable you are, but being as open about your symptoms and how you're feeling, just so we can make sure that we're putting in everything in the little box and making sure that we can cover all of that for your exercise program. Because if you don't let us know, then we don't know, sadly, because we need to have really good communication with our clients in order to provide them with a program that is best suitable for them. So obviously our exercise program should focus on the core issues. So all of our main findings need to be targeted through our exercise program. And then, you know, there might be other little things that a client might like as well. So, you know, I have a client who really loves these upper body exercises, so I make sure that those are in there as well, but then focusing on, you know, the lower limb and making sure that we're targeting things for our gait and our balance as well. So number 4, it's never late to start moving, whatever it is. Even if you're sitting there now and you're waving your hands about, any movement is good. So, you know, it's really important that we just do as much as we can. It's all about finding that balance, making sure that we're not doing too much, but we are doing as much as we can in order to better our health. So again, if you need assistance with this from a health professional, then please do seek it. And yeah, it's very, very important to do as much as you can to keep moving, just so we can try and at least minimally maintain, but where we can improve our current situation. And you have the power to do that. So only you can do it. I can tell you 1,000 times and stand there with a whip and smack you and tell you that it's good for you, but if you're not doing it for yourself, then you know, then there's nothing else that we can do as health professionals. So I really hope that you guys have gained some good knowledge from this webinar today, and please shoot through the questions if there are any. Hopefully, I think Andrea looks like there's going to be a couple there as well, but
it's just wonderful. I do encourage people to throw in their questions, but please throw in your comments too, your experience of exercise, and if you've seen an exercise physiologist, pop it in so we can share that with the rest of the group, because it's fantastic. I think that you've really given us an insight, Tasha, about how, as an exercise physiologist, you have the ability to work out what the client needs, but you're also interested in what us as individuals have as our goals. And
yeah,
by working together, we can achieve a whole lot more. That to me has been a real key message in what you've been sharing today. So I really thank you for that. Just while people are typing in their questions, I'll just go through a couple of slides. This just kind of gives a buffer for the whole typing process. But as Tasha said, reach out to us. That's what we're here for. So whether it's through the MS Connect phone number, or whether it's through employment support, or by contacting one of the nurses or one of the social workers, that's what we are here for. So please make use of us. There's no such thing as a silly question, and I think Tasha said that before. We just want to be here for you with whatever it is that you need. Now, for some people, that might be tapping into some of the podcasts that we've got, having a listen to them, or maybe checking out the webinar library. Again, we've said a few times that it's a very different season at the moment while we're all living in lockdown, but that can be a really good opportunity for you to learn a bit more, for you to kind of get on the front foot of where you might gain more support or what the areas are that you need help with. So let's go back and have a look at what questions have come in. Actually, a comment from earlier that I thought I'd hold on to share because it's so true. Diana was telling me that she saw an article the other day that said sitting is the new smoking. So that whole idea of we're far too sedentary and we need to get moving, that's a great encouragement. Betty said it was a very excellent and enthusiastic presentation. It's remotivated her, so that's fabulous. That's a big goal for us. Monica says similar. Excellent presentation and very informative, and very impressed by your first webinar, Tasha.
Oh,
and
thank you.
She certainly said she finds that for her, exercise is a key way to help feel in control of her MS. Absolutely.
Yeah, definitely.
That's great. That's great. And actually, no questions have come through, just some lovely comments. So that's beautiful.
Good. I've given all the information in a good way, then I hope.
That's right. That's what it's all about. But I guess we would also just remind you that if things come up after we're finished for today, please just reach out with a phone call or an email, because we're always here to help.
Yeah.
When we finish the webinar, there'll be a little survey will pop up, and I would encourage everyone, please just give a couple of minutes so that you can give some feedback. And part of that feedback is letting us know what other topics you would be interested in hearing about, and what other subjects, what other things you would like us to present in these education programs. So please let us know that as well. Diana is saying her exercise physiologist has absolutely helped her be more functional. That's fabulous. And Nerida is encouraged. She feels she does need to exercise more. So hopefully this is the little push that you need, Nerida. I think we all need that push. Not many people are. I was wondering what you're training for that gets you to get up at so early in the morning, Tasha. That's a high level of motivation. That's great. All right. Thank you, everyone. Thank you, Tasha, so much for your time in preparing for today and in presenting. And thank you, everyone, for being online and being interactive with us, because that also really helps us to know that we're hitting the mark with our presentations. Denise is wondering when Zoom sessions are happening again from Lidcombe.
Oh, that's a good question.
You know the answer to that? I think they're coming up.
Yeah.
I would imagine that if you've been involved with those before, you will be notified of when they are. And when there's anything new coming, we will let you know by email. So I mentioned earlier the dance session that's going to be run shortly. And through social media, that's the other way you'll find out about programs that are coming up. So just keep your eye out on your emails and on your inbox. And yeah, great feedback that Denise loved them. So yeah, it's terrific to get involved in all sorts of creative things. It's the flip side of the negative of lockdown. The flip side is so many creative things are being made available online. And I know it's not what we're used to, and it's probably not our preferred way, but it's available and we've got to tap into them. All righty. Thanks, everyone. We'll look forward to seeing you at future education programs. So thank you again, Tasha.
Thank you, guys. Hope you enjoyed.
Bye for now.